Where are we going from here?
Yes. I think the only way we can get to this is by having communities involved and in the center of the response.
For the rich countries, for countries like Australia, but America, the European Union, Japan, increasingly China, where to from here means going to the doors of the finance ministers, to the governments and saying, hello, you need to do more, you have the money, we have the knowledge, we have the tools, we have the treatments. So where to from here means going to governments, going to the big companies and saying, cough up. We need more money, we need it now, we need to put that behind universal access to treatment. If we do that, we'll be a long, long way down the track to eliminating this wretched disease.
We go more testing, people on ART and HIV Safe Play, we hand HIV. And by 2016, I would like to see people coming out and saying, you know what, this is what we have done and this is the outcome that we have achieved. It's more people coming to testing, more people on ART, more people using condom for safe sex.
Even today, despite all the progress, specifically in terms of treatment, today maybe 14 million people are on treatment, but there are a number of issues we still need to address, including addressing the needs of key population, addressing stigma and discrimination. And again, there is a very important point on treatment. Treatment is not giving a pill to somebody. It's about addressing the critical enablers and synergies, because if you don't address the demand side, even if the supply is there is no uptake of treatment.
Compared to 2 years ago in Washington, there really was not much on the agenda about aging. It's an emerging field. There are very few researchers who are doing this work. There is very few data available on people over 50 living with HIV around the world, and that is a problem. It's a problem that only recently became recognized by UNAIDS, that more countries need to step up, the international response needs to step up and start even collecting the data so we can know what the response in the epidemic and the pandemic will be in the long term.
So between now and Durban, I'm hoping that we'll be able to raise issues for women living with HIV, certainly here in Australia, that we'll be able to get more information out to young women and older women, but particularly young women, and to get good curriculum in schools in terms of prevention.
In an Australian context, it would be great if we had sex education taught in every primary school and every secondary school.
I will want, and I think this is really the start here in Melbourne, I really want there to be a larger awareness of this is a long-term commitment and we need to be able to treat people well into their old age, and how are we going to tackle that? And obviously data gathering is the first part. The research is starting to happen now. I mean, in the West, in the United States, we're ahead of the curve because treatment access has been around longer. So by next year, by 2015, it's estimated that half of all people in the United States who are living with HIV will be over the age of 50. But that's really just sort of the tip of the spear that will be happening around the world, and that is happening around the world. That is happening in Southern Africa, we know that. So we just want this to be a fully integrated part of every time we talk about AIDS. Let's not cut it off at age 49. Obviously, we need to keep focusing on youth and people at their reproductive age, but there's no reason to dismiss a whole generation of people who are, a wonderful resource, who can share their stories, who have experience of having lived long-term with the virus, many of them, but who also need to be integrated into public health messages about being at risk. People are still having sex past the age of 49, so why are we not talking about that?
I see Global Village as the core of the whole conference. The implementers on the ground are coming together, having this dialogue amongst themselves to help each other. If I have doubt about how I'm doing things in PNG, especially, let's say, now I'm trying to work with sex workers or the long distance drivers or traveling between towns. Those are mobile men. And I want to start an intervention with them, but I don't know how to. There are people in India that have been doing it. There are people in Tanzania that have been doing interventions with those people. There are people in South Africa. And that dialogue we have in the Global Village. It's not in the plenary sessions, even though plenary sessions, but plenary sessions do it in brief. But when we're coming to Global Village to have that open dialogue, we go into more depth and how we relate the situations in like other parts of the world with our situation in PNG. And we can see that as they're different parts of the world, but we can take the approaches or interventions that they use and adapt it into the situation we have in PNG.
So what I would like to see in Durban is a show that the community is already more involved, that it's being taken into consideration seriously by governments, that they're being paid for the work they're doing, that they are really accompanying their populations for testing, for treatment, for adherence, for prevention, for support, for care, and that all countries from all regions have developed a better response, that people are dying less, that there's less discrimination, and that there are less new infections.